One of the key pieces of this project to develop strategies for targeting underscreened populations in Newfoundland and Labrador was to really understand our population.
What we were trying to achieve is to collaborate and build the necessary relationships with the community partners as they exist and the primary care providers. They are our connections in the communities. They are what I like to call our eyes and ears and our boots on the ground.
Would always characterize ourselves as being data rich yet analytic poor. So we set out in this project to first undergo a detailed analysis into our screening cohort. So we worked with a vendor that was involved in our cancer screening database to develop a dashboard. So the dashboard really allowed us to hone in on various regions and areas of Newfoundland and Labrador that we wanted to target, that we needed to work with community partners, public health partners, primary care to better serve that population. When we delved deep into the data, as an example, we discovered that we had a overall program inconclusive rate of around 4%. So that would mean fit tests that needed to be redone, and because we couldn't determine positivity or negativity for an array of reasons. The dashboard singled out a specific area of the province where we had a 13% inconclusive rate. And without the analytics dashboard, we would never have known this. So we then took that data, and under the leadership of Bernadine, we reached out to partners in that particular part of the province, and we held presentations, we held engagement series, and we asked a series of questions around how we could better serve. What were reasons why we're seeing such a high inconclusive rate in that particular part of the province? And some of the feedback we received was around our instructions were kind of too wordy, weren't exactly clear. And so we took that important feedback and came up with the notion of producing new instructions that were wordless, that were heavy on pictures and diagrams and quick tips that people could use to get a more successful test on first attempt. And so we quickly then developed some of those instructions, went back to our partners to seek more advice, and then produced what we call, with the help of our partners in Ontario, wordless instructions, and we were able to put them into the program, and we're starting to see now a slight dip in the inconclusive rate in that area, and we're hoping that that's a direct result of those instructions. But then we'll also go back to those partners now, and as part of the sustainability of this project, continue engagement, and is this working, and what areas can we further improve on to better enhance the screening experience.
Essentially an assessment of their region, their zone, their community, and their client populations, learning from them what they perceive to be the gaps and what their needs are in particular to colon screening and the other population screening programs as well. So for our knowledge transfer events, we hosted them in 3 regional health authorities, and we targeted some primary care providers, primary care facilitators within the regions. So we chose this as an opportunity to provide an update using the information that we had available from the analytics, sharing with them the statistics and the analytics for their respective zones and their respective communities, and then reviewing the program, what was available to them within our program, and how we at the colon screening program were available to assist them. One very simple strategy that was identified was the actual use of our FIT kit as a demonstration kit. in some parts of the province, something as simple as sharing some of our kits with these primary care practitioners to use as teaching aids and demonstration with the clients has been a key strategy, and one that's been well received with our providers. Obviously, the biggest challenge was the COVID-19 pandemic, and the diversion of a lot of primary care staff into redeployment for COVID-19 associated activities. Even though the height of the pandemic was poor timing, it was good timing in the sense that I think a lot of these practitioners kind of have us in the bank and will utilize us now for some community engagement and public health education as they make their way through the public health protections. I think another challenge that we're identifying is the number of people in our province that we are identifying as unattached to a primary care provider, which will impact their access, which is why it's so important for us to work with the primary care leaders in this province.
For me, I think one of the biggest learnings is the need to understand your population. You can't assume that the same method of recruitment, the same means of promotion is going to work everywhere. And so you've got to be able to be on your toes at all times, pivot, seek new partnerships, maintain existing partnerships, and I think play to your strengths. So one of the strengths that our program has is that we have coordinators on the ground throughout the province, and they have established partnerships, be it with cervical, be it with breast, be it with colon, but take those partnerships and bring them into your circle, if you will. And screening is screening, and anything that we can do to promote screening in colon, breast, or cervical benefits to people. It increases access, and it provides service for better health outcomes in the province. So for me, certainly use the tools that you have at your disposal, and always be willing to change and pivot.
My first key learning was that investment in analytics, and going forward, moving into the future, how important it is for us as a program to have the updated analytics so we are able to identify the areas of the province where there's gaps, where there's needs, and then we can optimize our strategy to address the gaps and the needs. In terms of community engagement, one of the things I was surprised to learn is the impact and the popularity of social media, right? And how people encouraged, Facebook ads, and that really impacted our communication strategy and our communication plan. And from that, we engaged a graphic designer, got some updated graphics, have done a communications plan with our respective regional health authority. But that's something that a good communications plan moving forward as well was key learning for me.
The more that we can understand in terms of data, we can take that and turn it into good decisions, take it and develop it into screening strategies. So it's updating and maintaining our analytics dashboard, that in collaboration with our new cancer screening database, will allow us to do this with ease. We can produce data now that we've never had the ability to do before. And that allows us to tell a story of colon screening in this province, and cervical screening and breast screening in this province, and lung screening when it comes in terms of engagement. It's valuing your relationships and realizing that we're not in silos. For me, Bernadine was able to bridge so many new relationships across the province, which are very important, and we're not in this alone, and utilize the strength of the partners that are on the ground, because we're all seeking the ultimate same message at the end of the day.
Communities and practitioners will take some ownership for the numbers, right? If you give them good data for their areas of responsibility and their catchment areas, there is some ownership there. The most important thing is to listen, right? These people, the community leaders know the communities best. The issues in one community or zone may not be the same in another. So you have to listen, and you have to be able to be responsive, and you may have to tweak and tailor your strategies depending upon the needs that are identified within and from the community itself.